Well, with marijuana, it's complicated because in levels as low as 1 to 3 nanograms per milliliter, that's a tiny, tiny amount, you can have some cognitive impairment. And for many of the medical conditions I discussed earlier, patients need about 10 nanograms per milliliter to get some therapeutic effect. Many of the scientists that were looking at this wanted a zero tolerance policy in Colorado. Just, either it's in your system and you can't drive, or it's out of your system and you can drive. But there was a lot of pushback for those in favor, and knowing that people who use this medicinally, as well as recreationally, will have higher levels. So the compromise was the cutoff would be 5 nanograms per milliliter, but it is absolutely meaningless from a scientific place. It was a compromise, and we really don't know who's going to be driving impaired and who's not with this level. The other thing that we've kind of learned, trial by error, is that edibles are not necessarily safer than smoking marijuana. And just intuitively you'd think, well, it's probably better to eat marijuana than to get all that junk in your lungs, not just the smoke from the burned weed, but potentially pesticides or other contaminants that might be in the marijuana that's really not inspected or audited in any way. But what happens with the edibles is you don't get the same immediate response from it. When you smoke marijuana, it's pretty quickly that people will feel effect from it. But when it's eaten, it can take 30 to 60 minutes for it to get into the systemic bloodstream and into the brain, and for people to feel some high or change in their mental status. So the problem with that is the packaging of edibles in Colorado really didn't spell this out very well. And an example I can give you, there was a 19-year-old college student visiting Colorado from Wyoming. He visited a dispensary, he bought a cookie, and he chipped away at the cookie and nothing was happening. He just eat pieces of it and nothing was happening. He got impatient, ate the whole cookie. And then after about 30, 40 minutes, he began to experience effects from the THC in the cookie. He got very agitated, he got very psychotic, and he jumped off a balcony to his death. It was very, very sad. We were, and proponents have said all along, no one's died from marijuana. Well, maybe not the less potent marijuana from decades prior, but this can, in fact, be very dangerous. The second case involved an adult man who bought edibles from a dispensary, and they were little gummy bear-like candies. And the same thing, he ate one, nothing happened. He ate another one, nothing happened. And after he'd eaten several of those and time had passed, he also got very agitated, very psychotic, went home, stabbed his spouse, and he's now incarcerated, and the children are in the custody of Child Protective Services. So I know these are two dramatic cases, but I think they do illustrate that so far this industry has not been regulated very well. Now, what was interesting with both those cases, if you look at the packaging, for example, on the cookie, the instructions were to eat 1/6 of this cookie. And I say, who in the world is going to eat 1/6 of a cookie? That makes no sense. And same with the little gummy bears. I think it said eat one, no more than one in a 24-hour period. So not very safe, right? This is just a picture of some of the edibles. It comes in candy and chocolate and cookies and crackers, and they make butter infused with THC and peanut butter and soda pot, P-O-T. So that's what's out there. Okay. So the next thing that happened is we had another ballot initiative to create another amendment to the Constitution, which would legalize marijuana outright for recreational purposes, not just for medicine. And what has happened in Colorado also happened in Washington State, and wherever the campaigns are across the nation. I call it the Trojan Horse effect, that these proponents, and in Colorado they were from outside of the state with a lot of money to lobby for this to happen. They come in, they appeal to the compassion of the people. Let's make medical marijuana available. Once that is legalized, there's momentum for full legalization, and it happened pretty quickly, and that's what happened in Colorado. This was November 6th of 2012 when Amendment 64 passed and marijuana became legal. And this was April 20th, 2013, and there's a story behind this. In Colorado, every April 20th, the kids, I'll call them kids, or 20-somethings, or in their teens, they celebrate marijuana, and they all get together on the Boulder campus in Colorado and just light up. And it's grown over the years and gotten bigger, and it got so out of hand on that campus that one year the university put like manure in the field where they usually congregate, and that did not deter them, believe it or not. Another year, I think they turned the sprinklers on, and that did not deter them. And they finally chain linked the area, and they closed the university for a day, so everybody migrated over to the Capitol in Denver and had their regular party. So I would say that the passage of Amendment 64 now is the cart before the horse, because this is exploding in Denver, and as good as our regulators are and our law enforcement and our government, I give them a lot of credit, there's lots of things we can't anticipate, and it's just sort of grown out of control, and I would say it's scary not to know exactly what's going to happen next, okay? And our governor said, given that this is still illegal federally, don't break out the Cheetos just yet. He's saying you need to be cautious because while it's legal in this state, the federal government could still come in and create a lot of problems, okay? You can skip that. And you can skip that one too. And I would skip that one. And I would skip that one. Okay. So I talked about some of the potential good medical effects of marijuana if it's studied properly, and the kind of research protocols that we use for other drugs are implemented. But there are a lot of problems with it. And again, I mentioned how potent it is now. It's not the marijuana from the 60s or 70s. And what we've seen is an increased risk for addiction, and I'll go into that in a little more detail. But certainly we're seeing people with bona fide psychosis who have used marijuana in Colorado, anxiety and depression. There is a risk for cardiovascular disease. I mentioned the cognitive impairment. Yes?
Would you define psychosis?
Sure. I'm sorry, I should do that. Psychosis basically means that you have perceptual disturbances. And it can be in the form of auditory hallucinations. You think you're hearing things that are not there. Or it can be in the form of delusions, which are fixed false beliefs. For example, someone may think their neighbor is poisoning their food. Now, the neighbor might be doing that, but not likely. So delusions and hallucinations, okay? And then lots of pulmonary problems. That it's, there's some debate about whether it actually causes lung cancer. I've seen pretty well enlarged studies in New Zealand where marijuana is used at a comparable rate to the United States, and they really have some pretty powerful studies that show a link between smoking marijuana and ultimate lung cancer. But aside from that, there are people who develop chronic bronchitis, kind of an irritation of the lungs, or increased rates of infection. And again, it's probably partly related to just the irritant of smoke, any smoke in your lungs, but also, as I mentioned before, the adulterants, whether it's pesticides, whether it's molds or fungi in the marijuana, or who knows what else it might be cut with. Okay. Another concern for women of childbearing age is that THC does cross the placental barrier, so it gets into the fetal bloodstream. And what we see with children that are born who have been exposed in utero is that they're born smaller for their gestational age compared to babies who weren't exposed. And more importantly, they're exhibiting signs and symptoms similar to babies who are born that have been exposed to other illicit drugs like cocaine. They are inattentive, they tend to be hyperactive, they have problems with learning and memory. And I wish I could say it was an acute syndrome that once the marijuana's out of their bloodstream, they do better. But what we're seeing is these problems persist into adolescence. So you have a baby born with this disadvantage and it persists, and they may be trying as hard as they can in school, but you can imagine if they're struggling that they may become very discouraged and in the absence of this exposure, may have been a very good student and a high achiever, may be very discouraged and drop out if they're just not making the grade.